Good afternoon, everyone. Welcome to Diabetes and Kidney Disease, part of the Diabetes Sisters Life Class webinar series. It's my pleasure to welcome you to our next installment. My name is Anna Norton. I'm the CEO of Diabetes Sisters. I will also be moderating today's webinar. Today, I'm really honored to welcome Nancy Lepain, MSN, APN-BC, to our faculty of webinar presenters. She's a graduate of Boston University for both undergraduate and graduate degrees, certified as an adult nurse practitioner with a subspecialty in nephrology. She spent 20 years at Fresenius Medical Care, which is the world's largest provider of dialysis care, and spent another 10 years managing the Kidney Mobile at the National Kidney Foundation of Illinois. In this role, she traveled around the state of Illinois, bringing health care to those who are either uninsured or underinsured. And during this time, she served more than 25,000 people. Please welcome Nancy to lead us the next half hour on diabetes and kidney disease. Nancy, I'm going to pass this on to you. I also want to mention that you may ask questions during the webinar, and we will try to answer them in the time allotted. Thanks.
Okay, thank you, Anna. Thanks for asking me to do this today. It's my pleasure to do it for you and for your audience. So before we can talk about kidney disease, or before you can talk about anything, you have to know a little bit about what it is you're talking about. So what is chronic kidney disease exactly? Well, there are a lot of definitions for chronic kidney disease, some of which are incredibly complicated. So this is the way I like to define it. Chronic kidney disease, or CKD as it's called, is defined as a gradual loss of kidney function over time. Now, this loss of function can occur over many years, sometimes as many as 20 years. The kidneys are amazing organs, and I think you'll see as this presentation goes on exactly how amazing they are. And you can lose up to 90% of your kidney function before you become truly symptomatic. So how do we diagnose kidney disease? Well, it's really quite simple, and we can say that chronic kidney disease is present when the glomerular filtration rate, now that sounds like a very complicated thing, or the GFR, goes below 60 mils per minute for 3 consecutive months, or when there is more than 30 milligrams of microscopic protein in the urine. Now, what does that all mean? Well, the GFR is a very simple way, actually, to calculate kidney function. Most laboratories in the United States of America will give you your GFR when you have just a basic metabolic profile done. And by the end of 2016, it's going to be mandated that every laboratory in America report out the glomerular filtration rate. So in very simple terms, the GFR tells us exactly how well your kidneys are functioning. And when that number falls below 60 mils, and it's below 60 mils for 3 consecutive months, then we say that this particular person has chronic kidney disease. So what are the causes of kidney disease? Well, there are several causes, but the 2 main causes, and one of the causes that's most dear to all of you, is diabetes. And the second major cause for kidney disease is high blood pressure. Now, oftentimes people who have diabetes also have hypertension. Diabetes and hypertension are responsible for more than 2/3 of all new cases of kidney disease. In the United States today, there are about 29 million people with diabetes. A lot of these people don't realize that they have diabetes, and of the 29 million, only 1.3 million have type 1 diabetes. So you can see that type 2 diabetes is much more prevalent than type 1. What exactly does that mean? Well, diabetes occurs when the body fails to produce insulin, and that's known as type 1 diabetes. And that's the type of diabetes that we think of most often in children or in young adults. And that type of diabetes has to be treated using insulin because the body fails to produce insulin. The part of the pancreas that's responsible for the production of insulin no longer operates, and so the body produces no insulin. Or the second type of diabetes, which is the most common type, type 2, occurs when the body produces insulin, but cannot utilize it. So if you could sort of close your eyes for a second and just picture out in the body and the bloodstream, there are these little cells that we call insulin receptors. And when we produce insulin, those little cells open up, they take the insulin in, and the insulin is carried throughout the body and utilized to correct and control blood sugar. So in type 2, we say that most people that have type 2 diabetes have what we refer to as insulin resistance. So they produce insulin for a period of time, but the body is not able to utilize it. So we know that diabetes and high blood pressure are the two major causes of kidney disease, but what are some other reasons that people get kidney disease? Well, people that have repeated attacks of glomerulonephritis, which is an inflammatory process in the kidney, can develop chronic kidney disease. People that have repeated bouts of kidney stones, where they have obstructive nephropathy, as we call it, where the urine cannot pass from the kidney down the little tube that leads to the bladder, and so the kidney gets distended. Those people can develop kidney disease over time. People that have chronic gout can develop kidney disease over a period of time. People that have systemic diseases like lupus can also develop kidney disease. And some people who have acute kidney injury, in other words, you may have a major traumatic event that causes acute renal failure from which you may never recover, and then that turns into chronic kidney disease as well. As we said before, diabetes is a major risk factor for kidney disease. So what should you do about this? Well, people who have diabetes should absolutely positively be tested for kidney disease at least once a year. And if your doctor does not test you for kidney disease, you tell him or her that they need to begin to do that. Very simple blood tests that you will see in a subsequent slide. Controlling your blood sugar and controlling your blood pressure are critically important in kidney disease. And in fact, I'm going to go one step further and say to you that if you have type 2 diabetes, even if you have normal blood pressure, it is a good idea to be on a low dose of a certain type of blood pressure medicine, and perhaps to even be on a low dose of something called a statin, which controls cholesterol. Most people, and I'm not going to say all, but most people who have diabetes also have a component of hypertension and also have an issue with cholesterol. But even people who have normal blood pressure and even people who have normal HDL and LDL cholesterol should also take medication for both of those things. If you see your doctor on a routine basis or your healthcare provider on a routine basis, and if you control your blood pressure and your blood sugar, this will help you to avoid diabetic kidney disease, to stay healthy, and to avoid the other complications associated with diabetes. About 1/3 of all people with diabetes develop kidney disease. And as we talked about in the beginning of this presentation, diabetes is the leading cause of kidney disease. There are about 27 million people in the United States that have chronic kidney disease. That amounts to about 1 in 9 adults in America, and 1 in 3 adults are at risk for developing chronic kidney disease. Chronic kidney disease is the 9th leading cause of death in America. You just heard that there are 26 million people with it. There are only about 435,000 people in the United States on dialysis. So what happens to people that have chronic kidney disease, who are unaware of it or who do not get appropriate care, is that they die as a result of complications. There are steps that you can take to avoid kidney disease, but you have to understand that you have to be proactive. Oops, I just lost my little arrow. There you go. So who's at increased risk? Well, you know, anyone with high blood pressure or anyone who has diabetes is at increased risk for kidney disease. If you have a family history of kidney disease, you're at increased risk. If you are an African American, if you are Hispanic, Asian, Pacific Islander, or a Native American, your risk is higher. And anyone over the age of 60. As you know, the longer we live, the more likely we are to develop some type of chronic disease. And individuals who are obese, and by that I mean people who have a body mass index greater than 30. Now, body mass index is the size of your body. It's the relationship of your height to your weight. Normal body mass index is between 18.5 and 24.9. 25 to 29.9 is considered overweight, and anything greater than 30 is considered obese. Obesity is a major risk factor for developing type 2 diabetes. In fact, we never saw type 2 diabetes in youngsters until the past 10 or 12 years, where we are now seeing a significant obesity epidemic amongst children. And so now we're seeing young kids, 7, 8, 9 years old, with type 2 diabetes. It's very, very important. If you are overweight, I encourage you to try to diet and to exercise. Remember that when you diet and when you exercise, 95% of the weight that you are going to lose is going to be due to your diet. Only 5% of the weight you are going to lose is going to be due to exercise. I see patients all the time who tell me, I'm exercising for an hour a day, 7 days a week, and I can't seem to lose any weight. Well, that's because they're eating exactly the same way they were eating in the beginning. In order to lose 1 pound, you have to give up 3,500 calories. So 3,500 calories is equal to 1 pound. So if you give up 500 calories in a day, you will lose 1 pound in a week. And the reason I encourage exercise is because exercise helps to kickstart your metabolism so that when you do diet, it is easier for you to lose weight. Exercise is good for you, and exercise makes you feel better. It really is true about the production of endorphins. So please, 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 if you don't exercise now, please begin to exercise with your doctor's approval for at least a half an hour, 5 days a week. As I said before, more than 26 million, it's probably closer to 29 million Americans have diabetes. And you ladies know more than I that it requires a lifetime of treatment. You're not alone. It's a huge commitment. But it is a type of disease that you have to manage on your own. We can give you medication, we can give you dietary counseling, we can put you in touch with nutritionists, we can put you on an exercise regimen and on a diet, but only you can control the disease. So knowledge is power, and knowledge and awareness are at the heart of good diabetes self-management. So how does diabetes affect your kidneys? Well, as I said in the beginning of this presentation, your kidneys are amazing, amazing organs. You have 2 of them. They're located in your abdomen towards the back. And if you make a fist and you look at the front of your fist, that's about the size of your kidney. Each kidney contains 1 million little filters that are filled with tiny blood vessels. When you have diabetes, and when your diabetes is poorly controlled, and when you have high blood sugar levels, this over time can cause these blood vessels to become narrow and clogged. And so that precludes the filters from getting enough blood. And when the filters don't get enough blood, they die off, and less waste and fluids are removed from your blood. Our kidneys are responsible for protecting our body's internal environment. Everything that happens to us in some way affects our kidneys. People think of kidneys as just being things, your bladder fills, you have to pee. That's what your kidneys do. That's only a very small portion of it. When I say our kidneys protect our body's internal environment, that's exactly what I mean. They're responsible for controlling blood pressure. They're responsible for the production of red cells. They're responsible for controlling fluid and electrolytes. They're responsible for secreting growth hormones. So you see they're incredibly, incredibly important. And it's amazing to think that they can lose up to 90% of their effective capabilities and still maintain homeostasis within your body. So what happens with diabetics is that over time, diabetics get what's called diabetic neuropathy. And this neuropathy affects the nerves in your body. It affects the nerves in your feet and your hands, and it affects the nerves in your eyes as well. What is it that you really have to do to protect yourself? Well, you can have a very simple urine test to check to see if you have protein in your urine. Protein should not be in our urine. Protein needs to be in our blood. Our body does not store protein the way it stores fat, and the only way we get protein is from the food that we eat. If you hear my dogs barking, I apologize for that. So it's incredibly important for your doctor to do a very simple urine test just to check for protein in your blood, and also to check to see if you have microscopic amounts of protein in your urine. And then a very simple blood test that we talked about in the very beginning of this presentation to determine your GFR. The GFR is a simple calculation that's determined based on your sex, your age, and a blood test known as a serum creatinine, and your race, whether you are African American or not. This is a test that you should have done. Every person with diabetes should have done at least once a year, if not more often, but at least once a year. You need to see your healthcare provider on a regular basis. That's your doctor, your nurse practitioner, whomever. You need to see a dentist at least twice a year. Why, you say, should I see a dentist? Well, having high blood sugar can cause periodontal disease. Periodontal disease that is not checked carefully can lead to systemic illnesses such as cardiac problems. Your heart and your kidneys are very closely related, so it's incredibly important to make sure that your teeth and your gums are in good condition. You also should see a podiatrist at least once a year to make sure that your feet are in good shape. Oftentimes, people who have had diabetes for many years don't have particularly good feeling in their feet or in their hands, but particularly in their feet. You could have a sore or a blister on the bottom of your foot that you don't see, that you don't pay attention to, that can develop into an ulcer, which left untreated can cause significant problems. You need to see an ophthalmologist at least once a year as well, looking for changes in the retina, because something called diabetic retinopathy can cause blindness. If we catch it early enough, diabetic retinopathy can be treated with laser. So very, very important that you see an ophthalmologist. Very important that you check your blood sugar. I like my patients to check their blood sugar at least 4 times a day. Most people balk at that, but you need to be checking your blood sugar at least twice a day, 4 times a day until you know that you have good blood sugar control. If you're a type 2 diabetic, then you should be checking it at least 2 times a day. When you are sick, you need to check your blood sugar more often because, as you know, or as I hope you know, being ill can cause you to have difficulty controlling your blood sugar. Diabetes is the kind of a disease that does not usually give you a pain. If you have a sore throat and you go to your doctor and he says you have a bacterial infection, I'm going to give you an antibiotic, you know that that antibiotic is going to take that sore throat away. Well, diabetes doesn't usually give you any type of external symptoms. And so when you don't feel poorly, you don't think about taking your medication. Very, 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 very important. I cannot impress that upon you enough. Do not go without taking your meds. You need to problem solve. It's very, very, very important. As I said in the beginning of this presentation, we can give you the tools that you need. We can give you the physical tools. We can write you a prescription. We can talk to you about your medication. We can talk to you about exercise. We can talk to you about quitting smoking if you smoke. But only you can control those things. You have the power to do it. You just have to do it. And you do these things by developing healthy coping mechanisms, looking for support, involve your family, involve your friends, talk to people, talk to your physician. If you have a doctor that you're not comfortable talking with or to, or if you have a nurse practitioner that you're not comfortable talking with or to, then you need to find another healthcare provider. Diabetes is going to be with you for your entire life. You need to find a support system that you can count on. This number that is you see on this slide is not the right number, and I apologize for that. If you have other questions about diabetes, if you want information about diabetes, if you want to talk to someone that you can depend on to give you correct answers about the diabetes, please call the National Kidney Foundation of Illinois, and I want you to please take a minute to get a piece of paper and a pencil or write on the back of your hand or whatever. I'm going to give you a phone number. That phone number is 312-617-4583. There you can get your questions answered. You can live a long and healthy life with diabetes. You just have to know that it is incredibly important for you to take good care of yourself. It's an expensive disease, but the cost of dialysis is far more expensive. I encourage you to do everything you can to maintain your quality of life, and you do that once again by taking your medication, keeping careful control of your blood sugar, maintaining proper weight through diet and exercise, quitting smoking if you smoke, having a simple test done at least once a year to determine your kidney function, and having conversations with your healthcare provider about diabetes and about healthy lifestyle. Thanks very much for listening in today. I hope that you found this conversation with me beneficial. And if you have any questions or comments, I would be more than happy to answer them.
Thank you, Nancy. I just wanted to let everyone on today's webinar know that we have recorded the session and this podcast along with the slides, and we will correct the telephone number on the slide. They will be available tomorrow morning on the diabetessisters.org website. Luckily, we have a couple of minutes left because, Nancy, we have a few questions. So I'm going to pose the question. We have 4 of them so far in the queue. The first is, what is the statistic for those with type 1 diabetes that do develop or currently have CKD?
Between 30 to 35% of people with diabetes develop chronic kidney disease. Okay. Of that 30 to 35%, 25% to 30% of them are people with type 2. The reason for that, and I want to be perfectly honest, is that there are much fewer number of people with type 1 diabetes than type 2. And oftentimes people that have serious side effects from type 1 diabetes are transplanted preemptively before they even start dialysis. So you don't see a lot of type 1 diabetics on dialysis.
Okay, thank you. The next
You're
question
welcome.
is, do high blood sugars without the indication of ketones still have a significant impact on the blood vessels and filtration process in the kidneys?
Yes, absolutely. We really look at, I don't know if this person is talking about ketones in the urine or ketones in the blood. We very rarely look at urine anymore with our diabetic patients. It's just not a prudent thing to do. There is a very serious condition called diabetic ketoacidosis, which, when not corrected appropriately, can cause death. High blood sugar causes what we refer to as hyperfiltration. You notice that when your blood sugar is very high, you urinate a lot more than you do when your blood sugar is what we call within a normal range. Hyperfiltration is not good for your kidneys. It has an effect on what we call the receiving coefficient of the kidney, which means that the kidney is allowing things that should stay in the blood to pass through into the urine. So having high blood sugar, even without the presence of ketones, is not good for your kidneys or your eyes or your heart.
Okay. All right. The next question is, what is the typical onset age of CKD in those with type 1 diabetes, and what are key symptoms to look for?
Well, this is the rule of thumb with type 1 diabetes is that usually when a person develops type 1 diabetes, after about 15 to 20 years, you start to see the impact of type 1 diabetes. Now, that doesn't mean that every person with type 1 diabetes is going to have a negative outcome, because that's not the case at all. That's why I stress the importance of maintaining adequate blood sugar control. I also like type 1 diabetics, if at all possible, to use insulin pumps, because you can get much better control of your diabetes. So you really can't say, like, okay, somebody has a diabetes, they get it, type 1 diabetes, they get it when they're 15, when they're 35, they're gonna have chronic kidney disease. They may never develop chronic kidney disease ever in their entire life. And the problem with chronic kidney disease, as I said in the beginning, is that there are very, very few symptoms associated with it. You don't know you have it until the disease is very, very far along. That's why it's critically important when you have diabetes that you get a simple urine test and a simple blood test to determine whether or not you have chronic kidney disease, because if you do, and we get it early, we can delay or prevent the disease from progressing. So that is the most crucial thing I could leave you with today, is to please, please, please stay in close contact with your healthcare provider.
Okay, thank you. All right, so we have two more in the queue. They keep coming in, so this is great.
Good.
Okay.
That's good.
All right, this person says, I have type 1 diabetes and hypertension. I've tried both ACE inhibitors and ARBs, but both cause my throat to swell. Do any of the other hypertensive medications have beneficial kidney effects?
Well, this person is well informed, and let me just say, the ACEs and the ARBs, as they are called, the ACE inhibitors and the angiotensin receptor blockers, are both renal protective, or protect your kidneys. And that's particularly true with the African American community. But if you have not had good success with ACEs or ARBs, I would definitely try a calcium channel blocker. That is my third line of defense, because the most important thing, what the ACEs and the ARBs do is if you're spilling protein in your urine, the ACEs and the ARBs will help to reduce the amount of protein that you're losing. But we know that people who develop the cough associated with ACE inhibitors and sometimes with the angiotensin receptor blockers have to come off of them. So the next best line of drugs are the calcium channel blockers. So I would talk to your doctor about the possibility of trying a calcium channel blocker.
Okay, thank you. Next one. Where is it? Oh, okay. If someone has great cholesterol, which includes HDL, LDL, triglycerides, a perfect ratio, and fluffy cholesterol in their bloodstream, why would they need a statin, which might have side effects?
Very good question. Very, very good question. My recommendation to people with diabetes is to be on low dose of ACE inhibitor or ARB if you tolerate it, and most people do because we know it protects your kidneys. And also a low dose of the statin, just in a prophylactic way. I think if you were to talk to most endocrinologists and most internal medicine docs today, they would agree with me. I'm not, for giving medications I'm not for doling out antibiotics when somebody has a cough, but when someone has diabetes, I am for doling out low-dose statins, low-dose antihypertensives. Just protects your body, protects your heart, protects your blood vessels.
All right. Well, thank you very, very much for the information today, Nancy. It's a wealth of information for us living with diabetes. If anyone has any other questions, please send them our way. You can email them to info@diabetessisters.org, and we will forward those questions to Nancy. And before we sign off, I wanted to thank all of you again for registering and participating in today's webinar. We had an off day. We don't typically do them on Mondays, but nevertheless, we had over 50 people register. And as promised, we've taken all of the registrants. We've entered them into a drawing for a copy of Diabetes 365 Tips for Living Well. And the winner for this webinar is Alejandra Marquez. So congratulations, Alejandra. We'll be contacting you to send out this book. Thank you again to everyone for tuning in. Check our website at www.diabetessisters.org for our upcoming webinar, which will be held on April 20th, and it will focus on natural ways to reduce allergies, led by Dr. Jody Stanislaw. Thank you all very much. Happy spring, and we'll see you next month.